This is a classic example of what we would consider a typical vertebra, okay? Typical vertebrae have similar features, even though those features might present different depending on what level of the spine it is that you're looking at, okay? All typical vertebrae have what's referred to as a vertebral or vertebral body, okay? So this whole main hunk of stuff here, that's your vertebral body. And then of course you would have an intervertebral disc that's going to attach to the superior and inferior aspect, okay? Coming off the posterior aspect of the body, we have what's referred to as the pedicle, okay? So here's your right pedicle, there is your left pedicle. Pedicles would be consistent on all typicals. Okay, we're now looking at a superior to inferior view, S to I. And what I'm holding on either side is referred to as the transverse process, okay? Because the transverse processes go out laterally to the side. If I look at a posterior to anterior view, I see this sticky off thing right here in the back, and that thing's referred to as your spinous process. When you palpate the back of your neck and the back of your back, those little bumps that you're feeling are in fact these little tips of the spinous process, okay? And then between your transverse process and your spinous process, on each typical level, you have an area in between there that's referred to as the lamina, okay? If you've ever heard of a laminectomy is where they make an incision, they cut that lamina, and then they remove the spinous and throw it away and allow for that cord to expand. Okay, coming off the superior aspect of a typical vertebra, we have two superior articular processes, and then the flat part would be the superior articular facet, okay, that's going to articulate with the next vertebra above. And then if I look on the inferior aspect, we'll get a little bit better view. Here, if we look A to P, you'll see on this view I have two inferior articular processes, and again, the flat part is the facet, okay? Now we'll look at an S to I, or superior to inferior view. That big giant gaping hole in there now is referred to as the spinal or vertebral foramen, and that's where you'll find your spinal cord passing through, okay? Now this vertebra here that we're taking a look at, this is actually an example of a thoracic vertebra, and just to kind of help differentiate between levels, remember there's 12 levels of the thoracic spine. You also have 12 pair of ribs that attach to each of those levels. So anytime you're looking at a vertebra, that's considered a thoracic vertebra, either on the vertebral body. Here I see one right there. If I flip it over, here's another one. Or sometimes you'll see them on the transverse process, although our models here are made of plastic and they're not as easy to see. Those are referred to as costal facets, costal meaning a rib. So if it's a thoracic vertebra, you'll always see somewhere on that vertebra, either on the body or the transverse, you'll always see an attachment for the rib. We call that a costal facet.